Hi, I'm Heather Whitmer, one of the owners here at LeBeau Skincare Center, and I'm here with Hillary Leibowitz-Schaefer today, one of the other owners of LeBeau Skincare Center, and we are going to talk about a treatment called Isolaz that we have here. So thank you for joining us here, Hillary. So talk to us a little bit about what is the Isolaz treatment.
Sure. So Isolaz is using a broadband light, and broadband light means that the wavelength has lots of different levels that we can choose from, and we can target what wavelength we want to use to target something specifically. So Isolaz can actually target acne, or it can target browns or reds. So it is a device that when the handpiece pulls the skin into it, we can, choosing that wavelength that we want to target, we can then draw the tissue in, have a pulse of light come out, and that pulse of light then either destroys the bacteria that is promoting acne, or it's going to target browns or reds, or it could be a mixture depending on what we're looking at to treat.
And what is considered a brown or a red?
So browns would be sun damage, reds would be more like facial veins,
Okay.
or just like pinkness to the skin.
Okay.
Or it could be post-inflammatory hyperpigmentation, which is redness or browns from acne or where acne used to be.
Okay. And who's a good candidate for the Isolaz treatment?
Anybody can be a good candidate. My favorite patients that I choose are going to be somebody that has acne oily skin,
Okay.
or rosacea skin, where there's some oil and redness. It could just be oil to the skin, or it can be some of that reds and browns, that sun damage, just uneven skin color and skin tone that we need to even.
So does it control oil?
It actually does.
Okay.
So when the heat of the Isolaz is it's drawing that oil out of that pore. So backing up a little bit, oily skin tends to, we have larger pores when we have more oily skin, and the oil's kind of coming out. We're set to be dry or oily naturally. So when we draw the oil out of that pore, the pore then is able to shrink in size down to where it should be. You need to continue with the treatments to keep that oil under control, because your body wants to have that oil there. If it's set to be there, it's going to keep trying to have it there.
And that's from heredity?
It's just, genetics and our makeup.
Okay.
Yeah.
So how many treatments then do you recommend if I'm a patient that has oily skin or I have acne? What do you recommend as far as to get my full results?
So if I am dealing with someone with acne and oil, I'm going to recommend 6 treatments. The first 4 are usually once a week, and then the last 2 I start to space them out about every other week. And then after that, it's going to depend on how their skin looks and what is going to be needed to maintain them. Some of the acne oily patients come in, every 8 weeks. It could be every 12 weeks. It could be every 16 weeks to kind of keep that under control. The oily patients that are kind of just oily, they tend to have a lot of what's called sebaceous hyperplasias, which are almost like little bumps that come from having overactive oil glands. So with them, I typically go through about once a month treatment, and then I try to space it out after maybe 4 to 6 treatments, about every 8 weeks or 12 weeks, depending on how far they can go.
Okay. And is there a certain acne that responds better than other acne with the treatment, or
Not necessarily, because of what all we have access to here at LeBeau, being connected with the dermatologist. We've really treated patients that are very cystic acne, or very hormonal acne, or very superficial light acne. It kind of depends on what we're dealing with, and a lot of times we work in conjunction with like Dr. Leibowitz or Darcel to kind of pull in that component of the medical, as well as, okay, well, we also want to treat it cosmetically. So pulling that all together, we can really attack several different types of acne. Well, all the different types of acne.
Okay. So walk us through a treatment, what from start to finish, what happens, and is it painful?
Okay. So the first thing that I'm going to do is cleanse the skin. And after I cleanse it, there's a spray, like a water spray that I'm using, and I spray the skin to keep it damp, and then I start to put the applicator on. When the applicator is resting on the skin, it draws that tissue in, and then there's the flash of light. If it's painful to somebody, it's usually because they have cystic acne,
Okay. Which is painful
to begin with.
Right.
So it's not that the treatment necessarily is painful, it's that I am touching really that area with something that it pulls it in a little bit, so that can be just a little uncomfortable. We make it as comfortable as possible. So I've never had somebody that couldn't get through a treatment, because it really is tolerable. For somebody that doesn't have the cystic acne, they really don't mind it at all. They might say it feels a little warm, it feels a little bit of a snappy kind of feel, but it's not anything that's that uncomfortable.
And what does the skin look like immediately afterwards?
You're going to be pink, red. That redness usually lasts about a half an hour. Again, it's just because the suctioning of it and the beam of light. Sometimes we get almost like a little bit of a rectangular pattern that's on the skin, but that doesn't last long.
So is there downtime with it then? Do you have any peeling, anything afterwards?
Most people don't really have any downtime. Some of the cystic acne, you might be a little more irritated through that day, but most of the time the next day you wouldn't even know that you had anything done. And actually what most patients say that do have acne is they don't feel as inflamed like that next day. They can tell the pressure really has come down just in general from the treatment, because it really helps to take that down.
Okay.
The other cool thing cool to me, with acne is that it really draws everything out. So between blackheads and clogged pores, you really see that coming out. So that's just it's nice to be able to clear the skin so much.
Yeah. Physically see
yes,
that
to physically see it being drawn out.
Nice.
Yeah.
And what's the aftercare like? Do they use specific regimens? Is there...
We have to really customize which we do that with everybody anyway. We customize regimens, for all different skin types and skin issues. So if I'm going to deal with somebody with acne, I really want them to be on an acne regimen. And I prefer them to start that before they even start the Isolaz, so I can get everything kind of adjusted to their regimen, and then we get into the Isolaz along with it. If I'm dealing with the pigmentation or redness, same thing. I'm putting them on a skincare regimen that's going to focus on those needs, but they can use those products that night, the night of the treatment.
Okay.
I typically don't have them stop using anything.
Okay. And what are the long-term benefits with the Isolaz treatment?
Reduction of oil, if that's what I'm targeting. Reduction of acne, clear skin. That's my goal with my patients. The redness from rosacea, because they get inflamed with that rosacea, it really reduces that. So long-term, kind of clearer, less puffy skin. Pigmentation, we clear that pigmentation. So as long as they wear sunscreen and they don't get in the sun again, that pigmentation will stay underneath the surface.
Okay, great. Well, Isolaz sounds like a really good treatment for a variety of different conditions. We do offer the free consultations with all of our services. So if you would like to come in and see if Isolaz is for you, please just give us a call.